Hi, this is Dr. Saxena, and let's talk on some very common chronic disease, which I believe is one of the. It doesn't give a room for the doctor to really get back to what can be done as such. In the sense, how this is a simple thing I'd like to put to everyone, each and everyone, because I can always tell you, once you reach the stage, it's highly difficult to come back to the normal levels. And yes, I'm talking about something on kidney disease, and the segment will be focusing more on how to protect the kidneys as you age. And this is a functional medicine, integrative medicine approach. And as you see these days, anybody after 40, they have increased chances of getting into a kidney disease. And there are there are number of patients who are on the edge, and they are waiting to get into that CKD, which is chronic kidney disease. This is what happens here is, this kidney disease remains silent for years. But many of you see this may not, you may think that this what this doctor is telling now is may not be relevant, because I don't have this kidney disease and all that. I suggest you try to look into this. What are the takes here? What are the ways by which we can prevent this thing? And if you have some of the things, you can always discuss with your doctors and all that. And what are the things you can do by your own? You can always look into this segment. I'll be discussing that particular stuff. And yes, I do believe kidneys are the most important filters. They are the most powerful excretory organ, and we need to see that your kidney should be properly preserved. It should not be overloaded. When I talk about this, let me tell you something about what exactly is this excretory system. I'll tell you, the God has provided us. There are four excretory systems which work in our human body. One is, of course, the kidneys. This is called this tract, and everything is taken out from the urine. And the other one is hepatobiliary thing, which is goes through the colon and rectum. And this is also one of the very efficient kind of thing. Third excretory system is your lungs, where you take out, a alcoholic tries to take out the get rid of that alcohol from the breath. And that's how in the breath that particular thing comes. This is, and the fourth one, which I think most of us are not aware, is the skin. Skin is the largest excretory organ. When you look into the body surface area, when you calculate that, this is one of the biggest one. And unfortunately, what I see these days, no one is using the skin well. People normally are not perspiring properly, and this is one thing which I have been covering in some other segments. I'll focus on the most powerful kidney excretory organ, which is the kidney. And you need to take the help of the skin, you need to take the help of the hepatobiliary things, so that you don't overload the kidneys. That is the most important thing what you need to do. I see CKD is a very subtle thing, and most of them, of the diabetics, they do have CKD. And because when we look into the proper things, we are very sure this is one thing which is what happens is, after the age of 40, your kidney filtration starts to decline by 1% per year. And this is a and if you are supposed, if you are having something like high blood pressure, this can be harmful to the kidneys and can amplify this percentage of decline. See, normally when the kidney function falls, as demonstrated by that elevated creatinine or as well as EGFR, or through the potassium level starts rising. You see what happens here is the normal working kidneys clearly clears of potassium from the bloodstream. And in case of kidneys who are not functioning proper, they are not able to clear that potassium. So the high levels of potassium become extremely toxic, and particularly if the GFR goes down. So increasing blood level of potassium is a sign of worsening kidney disease. This is the first particular thing, and we tell everyone who has got some impaired renal function not to take fruits and veggies which are has high levels of potassium. So there are, of course, there are medications which can help out to reduce the high potassium levels. So for me, the treatment of the kidney patients become a balancing act between the diet, nutrients, and medications. I'm talking about for a normal person, or for a kind of thing where I don't see much this one, but let us try to focus on how we can work on this particular stuff. So coming to the things, we believe that potassium should be around 4 and all that. Everyone knows how to work it out, do the blood tests and all that, and this is there are some other things which we now we try to work it out. We believe that there are some heavy metal toxicity, there are some toxins in the air, food, air, water, which are causing this heavy metals impaction. And once you have got high levels of lead or cadmium or strontium, this goes selectively and gets into your filtration system, and this is one of the common causes of that. So here we would like to tell you, there is no need to wait for the deterioration to happen. Start picking up early so that we can do something good by trying to modulate some of the treatments and all that in a proper way. And there are good ways actually of reversing this kidney disease. And I believe that we need to work out on some of the areas. There are some things which has got some antibiotics, you have got some statin drugs and all that. There are some things which really matter to the kidneys, and it's better not to overload this kidney by this unnecessary pharmaceutical overexposure, and try to see that you minimize this kind of stuffs so that things can be much better. And at the same time, we would like to tell you, this is one thing which has been a kind of big research, and my focus is try to see that if you reach at some point, try to get back to the safe levels from that danger zone, try to come back with that particular this one. When we worked on this particular things, we were able to look into, there was something like high levels of trimethylamine N oxide, which high levels often demonstrates a more dysbiotic gut biome, and this is one thing which is elevated. It predicts the renal complications. This is a thing which suggests that you probably have this renal issue and all. So coming to some other things which we try to work it out by galactin levels, there's a thing called ADMA. We try to work with some potassium and uric acid. I already told you, even the uric acid measurements can help. There's a thing called cystatin, which is easily this can easily monitor the renal inflammation more sensitively than EGFR. And I try to run cystatin, which is a simple thing, but it gives me a advantage over the other things to predict the outcomes and all that. So what are the things we have to look into that? Even by you have to look into water pollution, you have to look into the food kind of things, the lot of toxins in the food. You need to look at what is dirty dozen this doctor is talking about. You need to look into what are the pesticides. You need to look into some of the air pollution kind of stuffs, so that you can always lessen the toxic burden on the body. I apart from that, we try to tell what are the things which can help in a big way. How much magnesium to be taken, what is the kind of minerals, how do you keep your body in an alkaline mode, not into that acidic kind of stuff. So we work on this particular thing. Along with that, we advise something like herbs like quercetin or some vitamin C in a kind of which really helps in balancing this particular thing. This is I can always tell you, balancing a acid base metabolism, trying to see that your acidity doesn't go up and you try to become into alkaline kind of stuff. This is a very simple prevention which can help you in a long run. And I want everyone should look into what is this acidity thing this doctor is talking about. I want you to look into the pH of the water, pH of the urine, pH of the saliva, and check out what exactly is that, where do you stand as. And that probably we try to look at the pH of the saliva at the early morning, and we try to see the pH of the urine in the early morning, the first pass urine you pass. So look at that pH and come, we can always guide you in a proper way. These are some of the simplest things which you can probably identify, and you can work out on your problems, and see that you don't get into a chronic renal disease. So because what I have seen is most of the people, they miss on this particular things when they are being treated. And I just want, this is a kind of if I am able to tell that particular thing to reduce how to reduce the burden on the kidney by using skin as a detoxing excretory organ, optimize your hepatobiliary excretion, see that your gallbladder is normal, and your colon health is perfect. And by doing all these steps, I'm sure you are going to go in a proper way, and you will achieve that health. You will not get into something like CKD and all that. Even though you get into a early CKD also, we can always help you by working on this detoxing protocol and trying to maintain your acid base balance. And this is a big kind of thing, and I see this is mostly neglected by the people. And the key should be to pick up early. Thank you.